Okay, let me introduce you to the coxal bone. This is the coxal bone. It's 1/3 portion of the pelvis. In other words, for a pelvis, I need another coxal bone, the twin, and I also need a sacrum thrown in there in between. So the coxal bone is the result of the fusion of 3 separate bones. The ilium, I call them the elephant ear bone, the ischium, your butt bone, the one you're sitting on right now, and then the pubic bone, that's the label A there. Ilium, ischium, and pubis, and they all merge in between here. If this is one of the last bones to actually ossify, this is endochondral ossification. By the time you're about 25, definitely by the time you're 30, you have no more remnants of endochondral ossification that you see again in the acetabulum. So the acetabulum, the vinegar cup, they used to do shots with this, I don't know, okay? Call it the vodka tabulum. This right here is the fusion, made from the fusion of all 3 of these bones. So the acetabulum, again, another way of saying that, is not made up by just one individual bone, it is the fusion of all 3 of those. Acetabulum, of course, is where the head of the femur is going to sit, and I want you to appreciate the depth of this guy compared to the glenoid fossa of the scapula. This is way deeper, and that bone is going to fit in there way deeper, and we're going to therefore produce a much more stable yet less movable joint. So parts on the coxal bone. Well, again, the first thing we need to ascertain is whether or not this is a left or a right. Now here's the same logic. I know this points outward. You can't point medially, right? Because the head of the femur has to sit in there. So, and then I know that the pubic bone faces forward. So would it be a left? No, because the pubic bone would be facing posteriorly. I'm sorry, right. It has to be a left rather. Does everybody see that? Okay. So speaking of the pubic bone, this is it. Where the A sticker is, that's the body of the pubis. This is the pubic tubercle, attachment point for muscles. And you'll feel, especially on the real bones, on the very top of the pubic bone, you have this very sharp edge. That's the pubic crest. And then you have a ramus. What's a ramus again? When a bone takes a turn. You have the inferior ramus of the pubis and you have the superior ramus of the pubis. And don't get hung up on that, okay? Because if I was asking you that, I'd say where the bone is taking a turn, and that would clue you in to say, okay, I'm looking for a ramus. Then we move, arbitrarily down to the ischial bone. The big part of the ischial bone that you guys are concerned with is this roughened area. This is the ischial tuberosity. This is your haunches, if you will. It's what you're sitting on right now. This is the attachment point for your hamstring muscle group. This opening is called the obturator foramen. Obturator nerve, along with blood vessels, lymphatics, penetrate through this big old hole. It's typically filled with connective tissue. This is the greater sciatic notch here. Sciatic, this is, your big fat nerve, the largest nerve of their body, sciatic nerve, penetrates through this hole. And then this right here, under this label C, this is the lesser sciatic notch. Greater, lesser. Then, if we look at the ilium, now there's different parts of the ilium, and the ones that we see, this little knob right here in the ilium, and this knob right here that's labeled B, that's the anterior superior iliac spine. This is the anterior inferior iliac spine. And I don't want to say that, so we say ASIS and AIIS. This is the posterior superior iliac spine. This is the posterior inferior iliac spine. PSIS, PIIS. Attachment points for musculature. Sartorius, rectus femoris, respectively. On the ASIS and PSIS. Do I have you guys know the gluteal line on the ilium? I don't think so. You do? Okay, this is the gluteal line here. Remember, this is your rump muscles. Gluteus means rump. This is where your gluteus medius and minimus originate from. This is the iliac crest, right? You guys can see in, real lean people, you see that outline in their hips. That's the iliac crest that you're seeing there. And then if we look here on the medial surface, you see the structure that looks like an ear? This is called the auricular surface of the ilium, which articulates with the auricular surface of the sacrum. This forms your sacroiliac joint, which happens to be an ampulosis joint. Auricular surface. Did I hit everything?
Can you point out the bottom, the pubic crest again?
Pubic crest, if you look at the pubic bone, which is here, there's the top part of the pubic bone. I'm putting my finger on it. It's a sharp part, and that is the pubic crest, like a mountain crest, right? Okay, questions on this? Going once, going twice?